Hi, my name is Cassandra Wesselman. This is my case study video 2. I chose to do Vioxx prescription drug deaths because I'm a biomedical engineer major, and the way I really want to go with my degree is the drug industry. I want to enhance the drugs that are on the market now to make them better so that they don't have the awful side effects that they do have, and I want to make new medicine that will cure diseases that currently do not have a cure or just have a stalling period rather than a long-term solution. On September 30th, 2004, Vioxx was withdrawn from the market due to an increased risk in heart attacks after 18 months of use. Why was the public failed to be informed of the life-threatening side effect before purchasing? Well, let's dive into the research. In January 1999, Merck tested Vioxx in comparison to naproxen to see if there were any digestive issues. In May 1999, the FDA approved for Vioxx to become a prescription drug. However, in November 1999, 70 patients out of 4,000 were having serious and/or fatal heart attacks. Research was published that estimated that 88,000 Americans had heart attacks from taking Vioxx, and 38,000 of them died. The question is, how did so many people suffer these heart attacks if the problem was caught so early on? The answer to that is the scientists at Merck skewed the test results to be in favor of Vioxx. They exaggerated the positives of Vioxx as well as to help their case. They manipulated the minds of consumers, other scientists, and the FDA that the only reason the drug was bad was because the other drug was protecting patients from having heart problems. They did this all to sell a drug that would be more effective than ibuprofen and less addictive than opioids. Merck's values are patients first, respect for people, ethics, and integrity. Yet with Vioxx, that was the complete opposite of what they did. They forged results, exaggerated positives, and made unrealistic comparisons, all at the risk of their patients. Merck, to this day, is still in scandals similar to Vioxx, or worse. While the scientists are to blame, they are at the bottom of the totem pole. They report to other scientists who have more power than they do, and those scientists report to higher people up in the company, like the CIO or the board of the company. Not only do the scientists have to face the brunt of all the stress that's put on with these drugs, but the scientists do as they're told because they fear reprimands such as loss of pay, suspension, or worse, termination of their position. If the head of Merck says that a drug needs to go on the market, the scientists must take charge like they did with Vioxx, and for them, that means lying and falsifying results just so that they can get ahead. What I would do different in this situation is accept the fate that is mine and say something. I would blow the whistle and I would face the consequences of this situation. Is lead gasoline repeated? The whole reason people can blow a whistle now and say something and stop whatever production is in the works is because of the Space Shuttle Challenger, which is why we have this opportunity now to blow a whistle to stop situations just like Vioxx. I will not lie or falsify results to help a drug go on to the market that I don't think should be on the market. I would look for a solution and a new job because, let's be realistic here, working at a company who doesn't really represent its values is not somewhere I want to work, no matter how much they pay me. Because if I'm going to work somewhere, I'm going to represent the values that that company holds. And lying and saying we care about patients and put them first is not the way to do that. And I would also have another scientist look at my results, and I would tell the news reporters, because Vioxx should not have been on the market.